Hi, my name is Dr. Dave Anderson. I'm a clinical psychologist at the Child Mind Institute. Today we're going to hear from a parent who has questions about how to treat their teenager's ADHD. This parent asks, I'm considering medicating my teenager with ADHD at the advice of her doctor, but she has some really valid questions about the medication and its side effects. What are the pros and cons, and what's the best way to address her concerns? I don't want to make her do something she doesn't want to, but at the same time, I think it could really help her. So we get this question a lot, not just from parents who are considering medicating their teenager, but from parents who are considering medicating a child at any age. We get this question from adults who are considering medication. So what the research shows is that if someone is considering intervention for ADHD, you have psychosocial interventions, which is a fancy word for interventions that you would do with a mental health provider that don't involve medication. And then we have psychiatric interventions, which are the interventions that you do with a psychiatrist or a physician and that do involve prescribing some type of medication. What the research shows is that while psychosocial interventions for ADHD, like behavioral parent training, individual therapy for older kids, who are in high school or college age, organizational skills training, those types of interventions can be effective for ADHD. And while medication can be effective for ADHD alone, the best approach for ADHD is a combination. It is a combination of seeing a mental health professional perhaps for behavioral parent work, or for individual therapy, or for organizational skills work, plus medication. That said, many people start with one or the other. And interestingly, what the research shows is that if people start with the psychosocial interventions, there are actually better outcomes for ADHD than if people start with medication. I don't prescribe medications for ADHD, but a lot of my work as a specialist in ADHD entails partnering with psychiatrists and physicians to make sure that kids are getting the best treatment that we possibly can give them for their ADHD symptoms. And frequently what we talk about with ADHD medications are the most common side effects. So psychiatrists will tell you the most common side effects of ADHD medications are perhaps nausea, perhaps some level of dizziness, and perhaps feeling a little bit kind of on edge. And that's common because if you think about what these medications are similar to, it might be similar to having a very strong cup of coffee or multiple shots of espresso. And what we see with caffeine is similar symptoms when people have too much of it. We also see appetite suppression. So many adults can tell you that when they have a bunch of coffee in the morning, for a little while they're not hungry, and then suddenly they're ravenous as the caffeine wears off. That's a similar effect to what we see with stimulant medication. So we want people to be aware of those symptoms, that they're expected. And a phrase that a lot of psychiatrists that we collaborate with will use is start low and go slow. What you do is you start off with a smaller dose of a stimulant medication, and then you kind of gradually increase that dose, knowing that a person is not experiencing significant side effects. And a lot of times the dosage of a stimulant medication is actually linked to the child's body weight or their size, where a physician or a psychiatrist might try to prescribe the right dose to help that child to get the focus they need, but not cause, nausea or dizziness that might happen if you've got too much of that medication on board. The vast majority of kids tolerate these medications well, and these medications are safe and effective for the majority of kids who are prescribed them. However, we also want to make sure to make room for the idea that a kid may experience side effects that are different than what other kids might experience. And there's a number of alternatives that psychiatrists and physicians have at their disposal, depending on whether or not a certain medication might be well tolerated by that particular child. The last thing I'll say about medication is something that we often say to parents when really talking about why combined intervention is so much more effective than either intervention by medication or psychosocial intervention alone. And that is that what medication does is you can think of it as, giving a kid a solid floor to stand on. It can make it so that they're less distractible. It can make it so that they're more focused. It can make it so that they're more ready to perhaps to engage with their academics or to learn. But importantly, it doesn't suddenly give them new skills. It doesn't suddenly make it so that they know how to be organized, or they know how to approach their schoolwork, or know how to approach certain tasks, or know how to approach a group project or a long-term assignment. Those skills take time and practice to develop. So one of the reasons why the combined approach can be so effective is that while the medication is giving kids a solid floor to stand on, the psychosocial intervention can be teaching them the skills and making it so they can practice it when they're most ready to practice with that medication on board. To learn more about ADHD, visit childmind.org.